Okay, the recording started.
Great, thank you. Welcome, everybody. It is March 10th. It is 5:32 p.m. This is the Boulder County Board of Health regular meeting. This is Morgan McMillan, board president. I think we also, I'll just read off the board members who we have present since I know a few of us are remote. We've got Lindy Hinman, board vice president. Amber Johnson, board member, and Brooke, why am I blanking on your last name, Brooke? Thank you. Board member present. Item number 1, public comments. I don't think we have any unless there's anyone who's joined the meeting. No, okay, great. Item number 2, approval of the February 10th regular meeting minutes.
I move that we approve the February meeting minutes.
I'll second.
Great, thank you. All in favor?
Aye.
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 Okay. Great, thank you. Minutes are approved. Item number 3, strategic priority deep dive, emergency planning.
Great. So we have Chris Campbell and Carrie Middleton here this evening to just take us through the emergency preparedness, response, and recovery deep dive. What we're trying to do is as we kind of reshape the director's report to really put a spotlight on our strategic priorities, is to also bring those strategic priorities to the Board of Health meetings to create additional space for you to talk with the teams that are leading each of the priorities. And this month we have emergency preparedness, response, and recovery, and that'll be followed by the stewardship, transparency, and sustainability strategic priority. So thanks. Go ahead.
And I'll jump in. So good evening, everyone. It's great to see you. And I'm gonna, we're in our hybrid world still, so I'll be looking up at the screen and talking to Brooke in the room here. It's great to see everyone. Great to see the community here this evening. My name is Chris Campbell, emergency manager with the agency. Joining me tonight is Carrie Middleton, who's emergency management planner with our team. Colleen Sinclair was supposed to be here as well, but she's not feeling well. So I think a really good opportunity. I really wanted Carrie and Colleen to share information with you this evening with the board and with the community. Incredible team that we have, and they've done a lot of work to help us create this, frame this strategic priority that we'll continue to talk to you about. I know we just saw you not too long ago, a few weeks back, and it's good to see you again. I think what we want to do tonight, if you want to move on to the next slide, please, is talk through a couple key points we hope that the board and the community takes out of this presentation discussion. 15 minutes or so that we have is challenging for a deep dive, but what we really wanted to do is really talk about what we're preparing for, why this is a strategic priority, what the landscape looks like that we're moving into, and why we frame this, the activities, the objectives, our goals, the way we did in this strategic priority, emergency preparedness, response, recovery. What we do know is we're preparing for a different landscape here. So we talked a lot with this board clearly about climate impacts. We've seen increased disasters, we'll talk a little bit about, and clearly there's a lot of uncertainty externally for the agency. What we do know as well is, responses, disasters are resource intensive. It takes a lot for this agency to respond, even the smaller responses we may talk a little bit about, like a tuberculosis response to an agency-wide, global pandemic. And we also know the current environment is resource constrained. So that is why this is a strategic priority, what we're moving towards. And we see these things increasing, these agency impacts, the impacts to community. That's the definition of a disaster, is having immense impacts to the community and our agency. And so we'll talk a bit more about that in relation to our strategic priority.
So Chris, good evening, everybody. My name is Carrie Middleton, pronoun she, her, hers. As Chris mentioned, emergency management planner. Chris got a fun slide with the cat which is our
Oh, I didn't mention
our
Lucy.
official mascot, emergency cat. I get the serious unhappy side. We do want to walk you through this just a little bit. So this is a graphic from the CDC. As it says, showing the impact of climate change on human health. We actually showed this to the board in 2023, but just wanted to briefly revisit it because honestly, it really does seem more relevant than ever. So certainly not going to read all of the information on this slide to you, but just to pick out a couple of highlights. As you can see, we are seeing more extreme weather, more instances of more extreme weather and infectious disease, for example, as it relates to changes in vector ecology. And just what we're seeing here in Colorado, in 2023, we had the highest number of West Nile virus-related deaths, a disease transmitted by mosquitoes, than we had seen in 2 decades. We actually led the country. We're also seeing related to climate change. Just in the past month, I think I have seen 2 research articles about the risk of urban conflagrations coming back for fires in urban settings. And sadly in Boulder County, we have seen that with the Marshall Fire. So certainly not a stranger, unfortunately, to these events. Climate change aside, I think everyone here in this room is aware of the potential for a pandemic with avian influenza and aware of increased numbers of measles. So, like I said, Chris had the kitty, and I have this. But this is the world that we live in, unfortunately. Patrick, you can go on to the next.
Actually, before we go, I would also just like to point out that given the tone of current federal conversations, if you replaced that center rotating circle with funding appropriations, that is another layer of risk that influences that second circle and that outer circle in very much the same ways. So we not only have the climate change impact, we also have the potential risk created by changes in federal funding and supports in a variety of areas that's compounding that risk.
Like mitigation and
Yeah.
response and planning.
Absolutely.
Just a
Thank you, Lindsay. Yeah, go.
quickly, are people online, are you seeing the slides okay? Got a mess, okay. I got a message that somebody was having an issue with the slides weren't changing, but
You can change.
looks good.
Thank you. So it's not going to be surprising that in a world of increased hazards, we also have a world of increasing responses. I wanted to say this in like a movie theater voice, they talk about in a world where, but of course the reality is that this is the real world and it is scary. So in 2024 alone, we had 10 emergency responses. As you can see, those range from wildfires, a TB case, a train derailment, the high wind event that created the public safety power shutoff event. In 2025, it's only early to mid-March. We've already had a hepatitis A response that I'm sure you're all very well aware of. And we're leaning forward with measles preparedness in light of increasing numbers of outbreaks elsewhere in the country. What I do want to say, though, is it's not just increase in numbers of responses, although we certainly are seeing those. Before I came to this agency, Chris liked to talk about a quiet emergency planner job focused on training and exercise. I think this is a myth, but it's not just the numbers, it's also the complexity. So we're seeing complexity that's familiar, like this is urgent. The potential health impacts are serious. We have a lot of coordination with a lot of partners, those kinds of things, but we're also seeing new complexities. As an example, again, I don't think it's going to be a surprise to this group, but just to illustrate our new context, is how social media has made it possible for misinformation and disinformation and rumors to spread very rapidly to large groups of people, which certainly can complicate responses. I think also not a surprise, we're seeing increased vaccine hesitancy in the country. So again, we're seeing additional things that we're having to incorporate in our strategies as we respond to things like infectious diseases and other hazards as well. Patrick, you can go on to the next, please, when you're ready. I promise we're going to get to solutions first. We did want to talk just a little bit about obstacles and challenges as we face this world of increased disasters at the same time as we have fiscal cliffs and fiscal uncertainty. So in an emergency response, we are going to draw on teams from all across the agency, just apart from the emergency management team. So our environmental staff, our epidemiology staff, our immunization staff, and other teams. And we're already seeing with fiscal cliffs and the increasing fiscal uncertainty in our world, our team's getting smaller. And so, put another way, you can see it's like we can look ahead to being asked to do more with less. We already have one key position on our internal incident management team, which is our response team, that has a key vacancy in part because of fiscal cliffs and staff turnover related to those fiscal cliffs. Also on the subject of resource constraints related but similar, a lot of the staff that we would have who respond to potential emergencies are funded by grants that don't necessarily have the flexibility to allow them to serve on an emergency response. So that means if we want their support in a response, we have to find another funding stream. And so again, just another challenge, another complication in our emergency response. Our internal systems, by which specifically I would point out things like communications and hiring, are really not designed for the rapid decision making and quick action that emergency and disaster responses require. And so internally, we have room to do in terms of making those efficient to respond to your emergencies and disasters. Some of our existing contracts, similarly with vendors, also don't have that built-in agility. And then finally, I think we can't really not mention that, as with I think every public health agency in the country, certainly public health has had, BCPH has had some strained relationships during the pandemic. And while we continue to work to repair those relationships, that also complicates responses. I will turn it over to Chris.
Thank you. You are welcome to, we certainly ask questions throughout.
Can I ask a
please.
question?
Yeah.
I'm really focused on this grant funding comment that you've made. And the obvious question I have is, are we thinking about strategies, and you'll probably talk about this too, rely less on grants so that there's more flexibility and agility, right, internally? So I'm just curious how you guys are thinking about that from a funding.
I don't know that we can rely less on grants as much as we can offer to change the contract language that allows for staff to have more flexibility who are on grants to support emergency response. Because that's often what the tie-up is that it's federal pass through the state. And then they're saying, our hands are tied. We can't let this person work on this. So often though, the good news is that a lot of times if we ask the state, can we get an exception as we're responding? They will go back to the federal funder and say yes, but it would be better if we could figure out a systems change that allows for contract language to allow for people to have more flexibility during emergencies.
We're also talking about things like for instance, in MDPH, we're talking about like, how do we deepen our mutual aid agreements so that we have flexibility when something happens to have a surge team. It's like if we don't have enough internal people that can surge onto a team, sometimes if it's a really localized issue, we have wonderful partners in the region who have capacity to come in, and they do. But just being really clear about kind of what the expectations are, what the relationships are, and how do we help each other in that space. So those are also kind of systems changes and contractual. I mean, it's not a financial exchange as much as it is kind of an agreement.
What percentage of this area is funded by grants versus not?
Emergency management is often
All grant funded.
All grant.
Except we did make a shift last year to move one FTE onto county funding to stabilize the program.
Yeah. So that was kind of preemptive. At one point, we were only grant funded and now we are county funded.
One person is county.
Is it, Lexi, are you thinking about, I'm just like back to that question, like, is there a need to shift more of this area of the organization onto more stable funding, quote unquote? I mean, I know none of this is predictable, but
So that's part of the work that we're doing right now, priority-based
Yeah.
budgeting, is making sure that we've got
The
the right
sources.
people and the right funding
Right.
sources and the right. But, as you know, it's like, okay, so we shifted people onto county funding, but the reality is that our county funding doesn't cover all the people who are on county funding. So
right,
this year it's pulling from reserves. And so as we go forward, we need clarity on like, what is our stable county funding level going forward? That's super helpful for us to know.
Yeah.
To be able to do these kind of plans. We did recently get a notification from the feds that the emergency preparedness grant that we get from them has been renewed, but until we see that in the 26 budget, it's really only guaranteed until September, through September. And so we're waiting for the confirmation that the feds are actually going to back that grant for the 26 budget.
Can I ask a related question?
Go ahead.
Is how much of OEM's budget is county funded versus grant? And are there any opportunities there? Like, I guess maybe this is part of the strategic activities slide, but just trying to understand what the relationship is with the Office of Emergency Management that the county has also.
Yeah, they actually are funded. My understanding is through a combination between county funds and City of Boulder funds. So it's the Office of Disaster Management for the city and county of Boulder. They also get funded through some of a couple other municipalities who participate. They do have some operating grants, but the vast majority of their funding is county or city funding.
But it's a good point. And I think with public health, emergency preparedness, that the historical piece is that the grants started after 9/11. And there was a lot of money that came after 9/11 to public health because they had a lot of white powder incidents and things like that. And then, but the funding has remained stable over
Even
25 years and even decreased while the cost of operating a program has gone down.
Salaries.
Yeah. So it is a bit of a challenge. And I think that's why during COVID, they were really pushing actually to put public health emergency preparedness actually under Homeland Security. Because this is actually a Homeland Security kind of challenge, to really think about pulling it out of HHS and moving it into a different department. So it would create more stable funding for the long term, but that never happened.
Yeah. Go ahead.
Yeah, so a similar question too, then. So how much overlap is there between, because I know you all went through this exercise last year, between public health emergency management versus county and versus city or even state? And then what percentage of response is supposed to be handled by public health versus those other groups?
You want to answer?
Yeah,
Just-
I think it is a complicated answer. So I think we have very clear roles. We're all hazards as well, but it's the public health components of those hazards. We have responses that we fully take on as an agency. They're not supported by our Office of Disaster Management or the Longmont Office of Emergency Management as the public health agency for the
An
community.
example would be the Hep A.
Hepatitis A.
Same response, TB response we had with school district, high school.
Is fully.
Yeah, I
so
can understand.
pandemic responses. So I would say that to juxtapose that with like a wildfire response where we're a component of that response. We serve that role from public health in those needs, and it's actually a little smaller response. So that what they do is the departments commit to supporting that with resources. And they stay in their role from public health to mass care and sheltering that happens under human services to transportation. The county commits transportation resources to that. So I think we're unique in that we take on responses directly versus some of the other departments and
So,
emergency
yeah.
disasters.
Structurally, we fall into ESF 8 and
10.
is it 10 is communications?
No, 10 is hazmat.
And is hazmat. So it's like these chunks of work kind of are public health's responsibility in any emergency. But the other thing that Chris didn't mention is that in the recovery space,
Yeah.
we have an enormous burden, often on our environmental health team and our
Very
EPI
natural.
teams. Because we get saddled with the supports like after the Marshall fire. It was everything. So there's the moment of the emergency that we have this, but then the recovery process, soil testing, water testing, air testing, communications to the public, dust mitigation, permitting. So there's a huge load that's kind of put on our environmental health team for the most part for recovery.
And I also say, so that team at the Office of Disaster Management is a team of 4. It's a team of 2 at the Lamont office. So in essence, what we all have to do with our small teams is leverage our resources in the county, county resources and commitments from department heads and staff. And I'd be happy to kind of walk you through what that looks like for the county, what that response structure looks like. I will just say we're about as lean as we possibly can get.
To put it another way, the Office of Emergency Management at Longmont and Office of Disaster Management in Boulder really rely on, to be as blunt as possible, on this agency to handle the
Yeah.
public health components of emergencies and disasters.
Because it's also the subject matter expert.
Yeah, exactly.
Yeah.
Absolutely.
So we will do things like move people out of nursing homes out of harm's way. We will support when they evacuate people to a central location. Our team will go in and make sure that, everybody's not catching COVID or measles or whatever the disease of the day is.
Are we doing work we're not actually getting paid to do by the
Yeah,
county?
I mean, that's my point, is that I understand that we have our own
But what I'm thinking-
expertise, but is there a way to tap into some of the resources that are going to the OEM then? If we're working in partnership to do some of that emergency response?
I would likewise say, Morgan, that they're working in a resource constrained environment,
Yeah.
to be honest with you, which is what they will go out and directly say to this board, to the department heads. They're relying on the resources of the departments to help them pull a response together. So again, it might be helpful at some point for me to walk you through what's called anatomy of disaster. So it shows how a wildland fire would unfold and all the agencies that are involved, from the first responders to that Office of Disaster Management and all the resources that basically the departments have to bring to make this work. It's an interesting question because I kind of skipped over it earlier about our mandates. We are mandated to have an emergency response plan, and it's mostly focused on a communicable disease. There's a lot of gray area in there. We can certainly explore, like, are we truly meeting the statutory obligations? We are. And what we've seen is this world is shifting for us. So more diseases, we just presented on a CBRN plan. So we've had a train derailment in the city of Boulder, big concerns about. Yeah, I'll talk about that. So we have big concerns about hazardous materials that move through our county, big environmental implications. You might be familiar with New Palestine. Those things are real threats to the community, and they're public health threats. And so we see that as a role for public health. There are various statutory obligations that we have to fulfill for that, from environmental health to emergency preparedness response side. Are these unfunded mandates? Absolutely. We're not fully resourced to do this. So I think that is something we're looking at from a strategic priority or strategic budgeting perspective. What we're also trying to say is we know that it has big impacts in our community. These are not going away. And we need to be prepared as an agency. So I think that's why you see this as a priority for our agency. It had a big impact from COVID. We didn't have the structures in place to more efficiently respond, which is what we're building internally here. So we want to be able to contract more easily. We want to be able to search staff. We want to be able to access emergency funds more easily that we hope are coming. They might not be. And then we together make policy decisions about whether those resources are available. And then we also have to look at our community, right? So we know we have incredible capacity in our community. We need to support them and create those systems to allow culture brokers and community ambassadors to come together and plan. make sure we're developing those systems there. So
I think
fits
it's-
nicely into this, but yeah,
Yeah,
and
it's
I
a
know we're
great
running out of time.
where our agency is trying to anticipate
Yeah.
a future need that there's no question of whether it's coming. And we're trying to address it now before it creates an urgency.
I also want to add that, we're also talking, the team is talking about, taking on some more active roles with recovery. So that way we can be more streamlined, because one thing that I'm not sure that we're doing when we have some of these responses and recoveries is building out the economic return, like how much it costs to do the whole thing. So we've talked about doing kind
How
of.
do we communicate that?
How do we get better at documenting and keeping track of everything so we can look at the true costs of what these responses look like? But this team is incredible, and they're small and mighty, but they also leverage everybody in this room. And when it comes to it, the whole agency rises and supports the team. And we do have really strong community relationships, partners. And we just need to figure out some of the infrastructure pieces to get those community partners part of the team. Because as more disasters come and the bigger they get, I think we're going to need the community to be part of the response.
Absolutely.
I don't know if you want to go to the next.
I know we're about at time. I mean, we've touched on the points we're going to touch on here. So we're focused internally, as you know, with our objectives, and an external one around supporting priority populations and building partnerships, supporting that capacity building of the community. So certainly more to come on that. But again, as we set the framework here of resource constraints, of more of these disasters, this is why we think this should be a priority for the agency, and we're moving ahead with it. I don't think certainly we talked, and we're trying to get to that end state and talking about that a bit. Again, we do need to be adaptive. We need to be more efficient how we approach things, because what we saw is staff burnout. We saw ineffective use of resources at times. So we are definitely going to build those systems. We're going to measure those systems, make sure they're in place. I mean, we're starting to, we're not going to get into that. We're running out. We're going to go that approach to talk about some of the things we're putting in, but those are starting to be in place to let us be a little more efficient internally with our systems to more quickly respond.
Amber, do you have a question?
Go ahead. Next one.
Yeah, I do. Thanks, team, for the update. This is really helpful. I'm wondering, with the more recent disasters that we've dealt with, including COVID and the Marshall Fire, did we do any post-mortem equity assessments in order to help guide us moving forward?
We absolutely did. In fact, we can share that with you. It's it's a documentary analysis we did called Putting Equity in Practice. That essentially is driving all of the activities, the objective around working with the community and really making our response equitable. So we're happy to share that with you. It's more of an analysis that documents best practices and gap areas. And we presented that to the national audience. To be sure, just to be very clear though, it doesn't have a ton of it doesn't talk about next steps. It documents, it talks about some of the best practices, like the community ambassador model, which is where we have paid cultural brokers in the community that help us connect with the community and tailor our response to the needs of the community. So absolutely, we have that. We're happy to share that with you all.
I would like to just jump in here and say that the work that they did on this equity analysis was a hot wash from multiple events.
Yeah.
And it was very thorough. We even took it to Commissioner Loachman, who reviewed it with us and went through it with us and gave us feedback on it. And it really is driving the strategic objectives, because we know that equity is the basis of all the forefront of how we respond.
Exactly.
Maybe you can share it with Patrick and he.
Yeah.
I think our partners also reviewed.
Yeah, I mean, that really does touch on this. If you want to move to the next one, Patrick, last slide, and then we're done, and we've gone through questions. No, we don't have a ton of time left. So, yeah, again, and this is actually one activity, or one measure, sorry. We want to make sure that those, priority populations are included in leadership, governance, decision-making, and really ultimately building the capacity of the community. And I think, that end state is clear, that we're more responsive an agency. We're working together as a community in the resource constrained environment, the challenging environment, really to ultimately protect public health in the community. So.
We also, one thing we didn't mention is we have a remarkable group of volunteers in our community. Our community is so highly educated and volunteer oriented, that we do have a pretty robust group of folks that stay on our roster that we can bring in to help with specific situations. And they're incredibly invaluable, to kind of boosting our search teams.
Yeah, in this group might have, if you're been with us for a while, it's our Medical Reserve Corps, Boulder County. It's a longstanding group of volunteers. We have about 270 right now. We surged up to about 900 during the pandemic. And these folks were invaluable. They were recognized by our commissioners. They provided support in testing and vaccinations, clinical support, working at the COVID Recovery Center for those who run house. So it was, I think, again, we can keep having this conversation about how lean we are and trying to be efficient, but
I will also
I think we're there.
There have been moments in recovery where the county has really
Yeah.
done a great job of being responsive. They supported 2 folks for the OWTS team to work on septic system permitting after the Marshall fire, because we had so many permits that came in at the same time. That was incredibly helpful. They also helped to pay for some of the air quality testing that happened after the Marshall fire that we didn't have funds to cover. So the county has been very helpful in strategic moments for helping us, particularly get through the recovery pieces that can be very burdensome.
Just to give an idea of the scale of services. When we were doing mass COVID-19 vaccination clinics at the Boulder County Fairgrounds, we had on average about 30 volunteers a day just at that site. And that doesn't include everything else they were doing, just to give an idea of the scale of what they were capable.
And Carrie, you had to manage a lot of that, and there were up to 900 volunteers at one point, and I think it's come back down.
It has.
Yeah.
So we're emphasizing how lean this team is and potential funding issues and restraints in the future. A large part of making sure that you run well with a lean and underfunded team is good planning. So have we yet done a real postmortem on COVID instead of any sort of planning for a future pandemic? I know that every time I ask this question, it gets punted to the state, but we have yet to see any postmortem and planning for future pandemic.
That's sad, because we did a series of hot washes
Yeah, we have.
throughout the COVID response. Every 6 months we did, and we would shift strategies. So we have 3 actual plans that we developed throughout COVID.
Can we see some of those plans?
Yeah. And we had really strong plans about how we shifted. Because we
Yeah.
couldn't, the situation was so dynamic, we couldn't do the same thing.
Yeah.
I have them. Do you want me to send them?
Yeah, I was literally gonna ask the same question, because I think it would be good for the board to see how this organization would respond to something catastrophic again.
Mhm.
And I would like to see another catastrophic, not that I want to see this, but another catastrophic event, like a major fire that rips through Boulder or something like that, which is that's a likely scenario, right? Like we all have to live with the realities of what we're dealing with climate change, something related to climate change. Well, I guess you would argue COVID is too. But I'd like to see some likely, like things that might actually happen in Boulder that we can anticipate. And I think you guys would be obviously the best experts to say, yeah, based on what we think, maybe it's a vector issue, maybe it's a fire, and maybe it's another pandemic. But I'd like to see how you guys would respond to something really big, where the gaps might be, where the funding comes from, and the resources that you would tap into so that we can, as a board, assess. I think what we're really concerned about, I am personally concerned about, is you guys are underfunded. We're in a resource constrained environment, but we also have to make tough choices about what gets funded.
Yeah.
What is sufficiently funded and what isn't. And this is an area that I feel very strongly should not be in any way underfunded if we can avoid it, even in this environment. So I think it would be helpful to kind of play this out a little bit more in detail with the board, Lexi, so that we can really understand it and then tie this back to the priority-based budgeting exercise.
Oh, yeah.
Because all of that needs to obviously come together.
So I will tell you that, the scoring for emergency management was pretty high. So,
Yeah, I imagine that would be the case.
yes.
I'd be hard pressed to think that's not a result that would come out.
And
but-
just as an example, I mean, this team does ongoing tabletop exercises on different topics. It's just like a run through of what would be in X case, and then they pick different topics throughout the year. They, right now, they're working with CEDM to develop a measles response plan.
With BBSD, they're doing tabletops with BBSD and CU.
Yeah, and also share with you,
Working
so
with
we
the
have
city.
what's called a hazard vulnerability assessment, which talks about our key hazards in the community. We've built a multi-year training exercise plan around that hazard vulnerability assessment. And we just updated our emergency operations plan, and we're updating plans associated with that HVA hazard vulnerability assessment and the training exercise plan. We have basically annexes. I always laugh. What's the annexes?
Annex.
Annex 5. I should know that, but yeah, so I mean, that's the challenge with you all, is it's tough to get these deep dives, share a lot of this knowledge. We do have a lot going on. We are focused more on the bigger picture with the strategic priority and building these larger systems. There's a lot of work that goes on the program level, like planning, training exercise for us in the community, plan updates. We've done several after action reviews of COVID. We do it after action review every response we do. So Marshall Fire, all these responses all up there. We have written documents that do an AAR, and it has an improvement plan with it. We can share all of those. It's a lot to read. But we're happy to give you some overviews of that. And this really drives kind of the program direction. This is broader systems things we're trying to get in place to ensure the sustainability of the program, the community's prepared, our agency's prepared.
Yeah. And between Chris and Dr. Middleton and Colleen, I mean, our team carries a lot of weight when they speak. They've gotten a lot of recognition. They've done trainings for other public health departments. They're well recognized for their expertise, and that's a huge credit for our agency.
Yeah, if there's in these scenarios, if there's, you guys could share the analysis you've done around capacity management and like, I would be really curious to know where you realistically think you'd hit a wall, right? Like how big is big
Yeah.
where
Yeah.
you couldn't realistically serve the community, right? And that is important for the board to understand, I think, especially as we're thinking about our budget, right? And how we want to prioritize and.
I think that is really tricky, but it is
Yeah,
something
it's
that we
complicated, I
do
get it, yeah.
when we have a response. So in the last response, even with hepatitis A, it was like, we don't have the capacity, let's call the state. And the state came in and helped vaccinate at the vaccine clinics. The state built up a lot of their capacity after COVID. So I don't feel bad asking for the state to come in because they actually ramped up. So that's what they're there for. So we are definitely careful of, and we'll talk about workload, but we are on that. We don't want to stretch people too.
So I just want to be mindful of our agenda and keep us moving forward, because I think this is really important information and appreciate all that you've shared. And then it sounds like there's some reports that the board would like to see following up, just thinking about in particular the prioritization, right? About what is, Lindy, I think you spoke to, what are the gaps? What are the priority for investment in terms of, having limited resources. So that would be helpful
And
if
could we
that's
also,
summarized someplace.
yeah, and just also, could we see a high level, like, these are the things that are part of the measles preparedness plan? I think that would give us an idea of what your planning looks like for some of these things.
I think it was in the director's report, was it not? Or no?
Yeah, we can certainly share with you.
Yeah, okay.
It's another thing we can share with you. No problem.
Thank you.
Yeah, this is super helpful. Thanks for all the hard work you guys did on it.
Of course.
The most important, in my opinion, the most important work going on in terms of our core and what we do. So
Okay.
really appreciate it.
Thank you.
Yeah. Tell the two other staff that do this work, we really appreciate that. Sorry.
One other.
Yeah,
The reality is that, you know, we saw this coming,
Yeah.
a couple of years ago, and we used to have 2 people, and now we have 3. So that's another example of kind
I
of
heard
seeing.
4 optimistically.
And now,
I heard four too.
you get a little of my time, you get some of Indira's time, you get, certainly get ANS time. But yeah, we've recognized this as a priority and have worked really hard to get ahead of
Thank you.
Okay,
it. Clearly, we were
We're all
shy.
ears. We're all ears.
thank you very much.
Thank you.
All right, so I think our other strategic priority deep dive is on sustainability, transparency, and stewardship.
Yes, and I will get us started in that space. I don't think I ever even introduced myself, which is self-law that I continually repeat. I'm Lexi Nolan. I'm the Executive Director of BCPH. I use she, her pronouns. So the reason that stewardship, transparency, and sustainability is really critical for our agency is because it really anchors our good governance plan. And an agency can only be as strong as its governance is. It is absolutely core to the work. And there are lots of facets of good governance. And what we really did in the strategic priority is we lifted up some of the spaces that we felt like needed the most attention. And those were really around streamlining systems and processing. And that had to do with making sure that our systems are talking to each other, especially our finance and budget systems and personnel systems are all talking to each other, that they are up to date and that they're effective, that we are using technology in smart ways that can help us really strengthen our internal controls and also create some efficiencies for us, and that we're removing non-value added work, that we're not wasting any time. Second, really more actively managing funding. It's great when you can have a decentralized funding management system when times are, you know, when you're rolling in money and grants are easy to secure. And when budgets get tighter and contract, then we have to have a more centralized approach to managing the work that we're investing in. So we're moving from kind of a highly decentralized way of developing budgets and prioritizing grant writing and things like that to a more centralized system so that we can create more alignment with our priorities. And then making sure those investment decisions are strategic at an agency level. In terms of increasing transparency, really making sure that the work that we're doing is the work that the community needs and that we're being effective in it, including with additional data, that we are providing opportunities for the Board of Health to enhance their oversight role for the agency and strengthening our accountability with the community. And then finally, strengthening the workforce. And this is another issue that we're trying to get ahead of. We have gotten warning signals for several years now that the public health workforce is both aging out and is also exhausted. And the current situation doesn't really help that scenario very much. So we want to be really intentional about how we are supporting our workforce by making sure that we're developing succession planning or that we're cross-training folks, that we're ensuring workforce for that can meet the community needs, and that we're also supporting workforce satisfaction. So that's kind of the encapsulating vision of what this particular strategic priority is about. And there's a lot of interdependence between these 4 objectives. For instance, we can't actively manage funding if we don't have some of the data, if we don't have streamlined processes and systems. Our workforce is strengthened by understanding better what our data needs, what our workforce needs are for responding to community priorities. So there's interrelations between these. And what we're going to do tonight is we're just going to take each of them and we're going to give you an update on kind of what's some of the work that we've been advancing in each of these spaces so far.
All right. Hi, folks. I'm Jordan Bullard, he, him pronouns, and the side projects and battle records program manager here at BCPH. And I'm going to talk a little bit about our administration staff landscape study. I've also presented to the board several times on the ANF refresh. I'm not going to bore you with details on the refresh again tonight, but I'm happy to answer any questions about it if you have them. But one of the pieces of ensuring that our administrative processes and systems are streamlined is ensuring that we spread the work more evenly and efficiently across the people who do that work. And so we started on this last June, and we had a survey go out to set a baseline of data that we can reference pertaining to workloads, roles, and responsibilities for people in this group. And that survey was really helpful. It gave us a high-level view of the kind of work that is done among folks that support these workflows. Probably wouldn't surprise you to know that people process a lot of invoices, order supplies, interact with members of the public, depending on the types of programs that they work with. A lot of folks spend time supporting leadership. So this gave us a really good high-level view of how this work is distributed across the agency, depending on what divisions they were a part of. With that survey having been complete in December, we started in on SIPOC analysis, or supplier input, product output, customer study for all of these various administrative support areas across the agency. And in each of these steps, we get a slightly more granular look at the processes, at the people who are working in these processes. And the SIPOC analysis in particular enables us to name the process for one, see who's impacted, who are the customers, and we see that some of the processes are totally internal among some of the admin support staff that support divisions, and some are external when we have admin functions that support, like the immunization program, for example, WIC, or the vital records program. So with that information, now that we have that in hand, actually next week, we're going to start in on our first admin staff capacity assessment. We'll roll this out across the agency, across all administrative support functions, and we'll use lean process improvement practices like process mapping, capturing pain points, and we'll do value add exercises and study different areas where we can figure out how we can reduce waste and eliminate inefficiencies. And I'm trying to channel Armando here a little bit in saying that the idea is to bring, get a smirk over there from India, to bring admin support staff to about 80% capacity in their work. I think it's higher for like in the corporate world, but acknowledging that some staff may be working at 90%, some staff may be working at 70%. So the goal here is to spread the work more evenly and efficiently across our admin support staff functions. And in an attempt to help support this work, to ensure that Armando is not totally burned out, all of the admin and finance leadership team have been trained, have received our green belt training on a lot of these processes on the Lean Six Sigma. And so we'll be supporting Armando and helping roll these out across. And then the final piece here is that the CLA will survey staff on financial processes and controls and use the results to build a shared vision around needed changes. That, turn it over to Patrick.
It's a great segue. Thank you. In terms of how we applied lean processes to what was really a very cumbersome, outdated process of our grant application or our grant intake process. And this goes back to the refresh. So now we're kind of fast forwarding to where we're implementing what we identified in the refresh as real pain points and how we can now improve upon that. So, you know, the process it wasn't just outdated, but it was overburdened with decision points, with steps, and it was relying on really static forms that were really difficult and cumbersome to update. So our mission kind of going into this. We really began this in earnest in about the August timeframe, and we're now at the pilot phase of improving our grant intake process. And of the entire process that's mapped out, at this point, we're really focused on the left side of the process, which is approving who gets to go apply for a grant. But what we recognized in the previous process was we were lacking a lot of significant data to make good decisions about which grant should we apply for, right? And are they a good fit for the organization? And are they feasible to implement? So our new form and our mission was to simplify the process, remove waste, automate our approval process, because it was very manual in the past, document the number and amount of grants that we apply for versus how many are awarded. So we can conduct sort of a one lost analysis, if you will. How efficient are we, and where can we maybe improve our grant application process? And then improve the pre-application data collection to make better evaluations of which grants we should be spending time improving upon. So as a result of that, looking at the refresh deep dive on the process that Jordan led, collaborating with our internal partners in finance and budget, doing user testing with our program coordinators, we're able to reduce the amount of steps and the time spent by about half. And we'll continue to look for improvements in that as we go. But right now we've cut that down in half. Our early testing has been really positive from our end users. There was some initial resistance, right? Because it's a lot of culture change. We've inserted a new step in the process of finance and budget having a say in, or at least giving a recommendation if a grant should be applied for or not. That's a bit of a culture shift. But we've been able, I think, to demonstrate why we needed to do that. And so far, we've got some good early adopters on board with it. So kind of, at the end of the day, right, if we've saved everybody time, we'll have more time to apply for grants, and we'll have more time to go out and seek new sources of funding. Yeah, and so that leads us into one of our tools that, again, Armando has brought to us as part of Lean Six Sigma, which is our innovation form. So we're going to use this innovation form across the agency and across processes to really document, what are the qualitative and quantitative reasons behind why we're doing something, what's the expected outcome, and then going back, measuring that every 30, 60, 90 days. Did we hit what we think we were, what we thought we were going to hit? Did we do better? Did we do worse? Where can we improve? And also just doing a post-mortem. It's a pretty long form. It's just a quick snapshot of it if you guys have seen it. But there's sections in terms of what could we have done better, right? What worked, what didn't. So it will help us become a better learning organization and continue to improve our processes. So I'll kind of pause there. I mean, this is the grant intake form, just snapshot. This is a very conservative estimate, I think, of saving $5,000 a year. I think it's extremely conservative. We'll save a lot, but which points to we had no data to go off of, right? So we'll have data now to go off of and really do some analysis in it. So that's a bit of a wing and a well, probably not a prayer, but
I would like to just say thank you, because I know this has been a lot of work. It's been a heavy lift, and the grant intake process was a huge culture shift from the programmatic perspective, but it's a much needed and happier group of people, I think, are now experiencing a really positive result from this lean process, and super grateful for both of you, because I know it's taken a ton of time and energy to build it, to go through the refresh process, and then to build it. I would say the grant intake tool was probably one of the hardest ones. And so you tackled that hard one early, right? Like that's like
eat the frog, right?
I will also say that Armando and Patrick worked on an innovation form in relation to the use of new technology for recording our Board of Health minutes. And I don't know if you've noticed a shift in the Board of Health minutes, but Patrick has certainly noticed a shift because his work time to prepare them has gone from over a full day of work down to about 2 hours. And so you multiply by that by all of the meetings that we have throughout the year. And that told us that buying that relatively cheap piece of software was a great move.
Chris and Carrie are like, oh, yeah.
Part of, if I can chime in, part of the whole idea for the grant intake form was to supplant, I don't know, 5 process steps in the grant process map that was dedicated to one meeting,
And
which was,
replace that meeting, eliminate the meeting.
yeah, which frees up so much time for people having to prepare for the meeting, having to hold the meeting and organize it. So
And it also centered power back to the divisions instead of putting it in the hands of the directors team. Because really the division managers really know their teams best, and so they should be making those final decisions, which is good. Directors team still approves it, but it's not as active, and having to ask so many questions. I just don't feel like that's gonna require all that constant email and feedback that you don't measure.
And we've built in some accountability steps too, that, to really formalize approvals along the way and to add accountability to the division. So when it gets to DT, right?
I can ask the question.
Yeah, you can ask the questions and you have confidence that it's been vetted. And ideally, right, and this is again, something Armando's pushing for, we want to get to where 80% of them are flowing through and DT's not having to stop and ask questions and review them and send back for more questions.
Yeah.
But
Can they keep us moving a little?
Yep.
Because I'm conscious that some folks have a 7 o'clock hard stop.
Yeah,
Can
I
we
just,
turn it
I
back
just
over to
want
you?
to
Oh.
say, thanks, because I know this is often the internal stuff is not, it's not the stuff that gets a lot of recognition often, but it really makes a big difference in our ability to do our work more efficiently. So thanks for all the work that went into this and continues.
And I'll just say, I mean, this like makes my heart sing, sadly. I love this stuff. And I think that I'm excited. It sounds like it was well received. And so replicating this kind of process for other areas, right, where there could be better efficiencies. And I love that it's cost savings, but also people are feeling more productive and happy in their jobs, which is a huge win. So love this. Keep doing this. This is awesome, especially in a budget constrained environment where we need to find every penny literally. So $5,000 is not a lot, but it matters right now, right? Everything matters. So anyway, thank you.
And that's like one estimate, because the reality is more efficiency in the grant seeking space could result in hundreds of thousands of dollars in.
Right,
additional grants.
exactly. I mean, just exactly. So yeah, it's exciting.
And we'll be able to measure the ROI eventually, right?
Yeah.
That's where we want to get to,
Right,
but we don't have an ability to do that today.
right, because right. Exciting.
I think it's back over to you, Lexi.
Yeah, so I'm going to take you through our third objective, which has to do with transparency and accountability. And I'm going to go through this pretty quickly. Some of it you already know, but some of it may be on your radar. We are working on the KPIs for programs and strategic priorities. I think that our target date for that is this summer. We are talking about developing an annual report. We really recognize that we need to be able to tell our story as an agency to the public. And to our partners. And so we are working on what that might look like. You all have seen the regular budget and finance reporting that's been coming through, that was made possible by implementing monthly closeouts that we could then prepare reports from, and quarterly updates to the Board of Health on the budget and finance. We're kind of giving Armando a break because he's had some stuff going on and has been otherwise occupied, but he leads a lot of this work.
Yeah.
The quarterly agency updates to the Board of Health and the Board of County Commissioners, you get a quarterly update that comes from me, that copies you and the commissioners on. And then also the priority-based budgeting work is a function of creating transparency and accountability, and creating a staff participatory process in that work. And then in relation to the fourth objective, that has to do with a thriving workforce culture, we have actually been doing quite a bit in this space. We are working on a transition plan so that we are maximizing the opportunity for internal staff to be connected to hiring positions that we need to go ahead and invest in so that we're minimizing disruption to staff whenever possible. We have developed a training calendar that both supports core training for staff and also creates opportunities for efficient and low-cost training on the areas for staff so that they don't have to go outside the agency quite as much. We are working on the 360s to support professional development and career advancement. We are hoping to roll it out for the management team this spring and have a full rollout over the summer for other staff. We are doing some investments in organization of cultural building, particularly in the areas of conversations, including using the courageous conversations about race protocols, having some restorative conversations and trainings on restorative conversations, and then leadership team development retreat that'll be upcoming in the next few weeks. And finally, to round it all out, a workload plan that Indira has been working on with staff for a while. And that takes us to our next agenda item. We thought we would do a little bit of a deeper dive on that.
Okay, so
I do real quick pause. Any questions about that strategic priority before we move on? Okay.
No, Lexi, the only thing you didn't touch on, but I know you and I have talked about recently is just your level of activity with partners.
Oh, yeah.
They're not just within the BOH, county commissioners realm, but
I
also,
should have thrown it.
yeah, anyway, just wanted to give you lots of kudos for that
Thanks.
as well, so.
Yeah.
Okay, let's go to the next slide. So I'm Indira Gujral, she, her pronouns, deputy director. I am gonna just go quickly through this workload plan. So if you have any questions, feel free to stop me. So workload has been a challenge since I've been here and I've been here 11 years. Okay, it's always been a challenge. I do think that some of the root causes that we tend to be super innovative in taking on new things and trying new things, and then we have a hard time letting go of other things. And so workload has been a pretty significant problem. And obviously during COVID, it was definitely highlighted. We had lots of burnout. And then when we had the Marshall Fire on top of COVID, it really kind of exacerbated things because it really stretched the teams really thin. And then this past October, we did an all staff where we talked about resiliency with staff. And it turned out that staff are still experiencing very high workloads. And we have some programs who I'm actually working with on dealing with burnout because they have such high workloads and are really committed to the community. And so what we have been doing is recognizing that we have to address workload for a few years now. And we know it'll improve mental health. It's going to reduce the burnout. It's going to keep people engaged in their work. It actually helps to produce, if we address it, we're going to be more productive because we're going to start prioritizing the work we need to do. It's working smarter, not harder. We are also going to increase insight into, really matching what we have in terms of resources to what we need to get done. And it's been kind of nice because this has been in process since 2023 that we've been working on this. But now it is aligning nicely as we start to roll out the priority-based budgeting because we have to address the fact that we cannot keep and maintain the workload. If we're going to let work go, we actually have to let work go. So we have to figure out what that looks like. Next slide, please. So just an overview about the workload plan and why we have it. But it's just basically a little guidance document that we had a couple printed out because we recently had a supervisor meeting and we went through it. We went through all the recommendations. Next slide, please. Okay, so we started this in 2023 and then we finalized it with management in 2024, but we had a lot of challenges, a lot of vacancies. So we didn't start implementing until 2025. But when we started in 2023, it was after we had been doing a year of Mentimeter surveys with the supervisors every month to say, how's your workload? And 20 to 25%, 1 in 4 supervisors were reporting seriously high workloads every single month. And so we got a group of supervisors together and we actually developed this work plan. So this work plan is not something I developed, it's something that we developed collaboratively. And we went back to the supervisors to make sure we were on pulse, did pulse checks, make sure this looks right, and then finalized by management team.
So the three biggest issues that came up in terms of workload challenges are one, meeting fatigue. So as we moved to the hybrid environment and we went online, it actually caused way more meeting fatigue. And there's a lot of research, and I can send the document to you, but there's a ton of research that talks about we invite more people to meetings. Our meetings are longer. We are no longer touching base in the kitchen or seeing each other passing in the hall. So and it's just really created a lot of challenges. So we developed some 5 best practices on like how to have a meeting. Do you need a meeting? What does this look like? Does it need to be in person? And some of the best research shows that if you are collaborating, you need to be in person. You can't be remote. So lots of learned lessons here that I think we went through and I think people are going to adopt, including moving from hour meetings to 50-minute meetings, moving from 30-minute meetings to 25 so people can run to the bathroom. So we're making some organizational culture shifts in this space because we know that hybrid is here to stay, right? It's not going to go away. The second was prioritization. We just really have not had tools or have had the training and a lot of equipment to be good at figuring out how to prioritize our work. And, people in this agency love the community. And so they will take on extra work and support their neighbors and community members. But the problem is that it just contributes to workload. We don't let go of work. I told the team in the supervisor meeting, I'm like, we're really not great about letting go of work. We have to be good about that. And then the last piece is about setting boundaries for yourself as an individual, setting your boundaries in the team, setting boundaries as a management team about what work we are going to do, what we're not going to do. So those are the kind of big 3 challenges that we are working through. And then what we developed as a group is recommendations for the individual, recommendations for supervisors, expectations for supervisors, because we expect supervisors to do these things, expectations for management team, and then these larger agency level investments, which include all of the work that Jordan and Patrick just shared and all the lean work that Armando's leading, which help to improve our systems and create efficiencies. Okay, next slide, please. This just shows you the implementation timeline. We implemented starting in January of this year starting with an all-staff meeting. We had a supervisor retreat just last week. So in March, where we went through this a little bit deeper and had, real conversations. And it was a very participatory event where we said, what do we got to do here, right? Because we're gonna have to change our culture. We recognize this culture's change is going to take a long time. So we are planning to complete this at the end of 2026. And I know that management team has to have some conversations too, because management team is maybe contributing to workload. Management team may be adding to things on people's plate and not realizing the impacts. So how do we create that speak up culture where people can push back? How do we create the boundary setting that allows for management team to be effective, but also recognize that we can't just keep asking staff for things all the time. So next slide, please. So here's some results that this would be fun to share. Next slide, please. So this workload plan is in a smart sheet, and Patrick, thank you, Patrick, which is like a project management tool, and I'm able to actually track how successful we've been. So since we started, we have completed 24% of our tasks, we have 16 in progress, and we have 60% more to do, which makes sense because we just got started. Next slide, please. This is a question we asked during the all staff in January. We asked all the staff, which statement closely represents your work-life balance? And again, you're seeing around 27% reporting that they are unbalanced and hoping for the best, right? That we'd like to get that number target down to a lot lower than that, but maybe less than 10%. Next slide, please.
And maybe not the same people ever.
Exactly. In that January meeting, we asked, are you excited to lean into addressing workload challenges? And you can see 29 out of 54, almost 47% said sort of, but 23% said absolutely. So we know that majority of people do want to do this. We only saw 2 no's, that it's not a challenge for them. So it is obviously something that we have to discuss. Next slide, please. The top themes when we ask people what you're excited to learn about is prioritization. Right, so learning, including what management can do to help reduce workload and external asks that maybe come from the other boards, the community might be asking too. Boundaries, making sure that everybody knows how to say no and can you say no. So we had a really good conversation with supervisors about power dynamics and boundary setting and understanding how that works with your staff and making sure that, you know, people can speak up. And Dahlia, she set boundaries with me because she said, Indira, you didn't create a break because I made them work through the break. And I said that was a best practice. And then I violated my own best practice. But that was an example of how we, you know, we have to listen to everyone in the room. And then when I asked, project management tools, delegation, and then systems changes. Again, back to the process improvements. Next slide, please. Two things, and then this was in the supervisor retreat just last week. What are the two things you learned about your role in addressing workload? So a lot of people walked away understanding how to set boundaries and then also understanding that we have to start prioritizing and we have to get better at it. There are some other words on there about modeling the way. As supervisors, you have to model the way, right? You can't be sending emails after 5. You can't be calling people on the weekends. You can't be asking people to do things that you know, you wouldn't take on yourself at those hours of the night. And then also making sure that people understood their roles and responsibilities. So that was another thing that we talked about. Next slide, please. So in summary, this is going to be a culture shift that's going to take time. This is not going to happen overnight. This is a 2-year conversation. This is going to take some training. This is going to require us to do some investments on teaching teams how to prioritize work and setting boundaries and understanding power dynamics. And then also understanding that all of this is going to contribute and help us be successful with our priority-based budgeting, which is going to ask us to really reevaluate our work. Okay, that's it.
Awesome.
Yeah, it's good stuff.
Yeah, it's really exciting. I'm glad to see at least half the staff are pretty receptive to the exercise.
Sort of.
Yeah.
Change management is hard. Change management is hard, but it's
Yeah.
good to put it into practice.
Great. Okay, so Dave LaRocca and I are here to give you kind of a mid-session legislative policy update. It also includes some federal updates. Just to get us started, though, I was having a conversation with Dave today about kind of the feeling of the session. And, you know, there have been a lot of bills introduced, but not as many as usual that have financial
Load or
that require financial investments. And we're seeing, I think that the budget challenges have kind of sucked the air out of the room in a lot of ways, so that so much of the focus of the conversation is really around the budget. That we're not seeing kind of the dynamic exchange around bills as much as we normally do in a usual year. And I'm happy to turn it over to you, Dave, to get us started in this conversation.
Thanks, Lexi. Hi, everyone. Good to see you all. Dave LaRocca, he, him pronouns, mental and behavioral health coordinator with SIB, and also get to help facilitate our policy work. So yeah, as Lexi said, we're actually right about halfway through our 120-day legislative session. And as of today, there's been 497 bills introduced. And yeah, the state budget has really, as Lexi mentioned, impacted the session. In short, the state's near and ongoing budget challenges have really been looming over this session. The budget right now is on a unsustainable path, and there's about a $1 billion shortfall for the next fiscal year. So as such, there's been really few bills that have financial implications that are moving forward. And Related to that, the next quarterly economic and revenue forecast is coming up on March 17th, so a week from today, and that will really give the legislators a clear picture of what they're facing when it comes to the next fiscal year budget. That budget, which is presented as what's called the long bill, is expected to be introduced in late March or early April. Next slide, please. So BCPH has been actively monitoring bills and coordinating positions and actions with all of our partners, the BOCC policy team, CALFO, CPHA, and community partners as well. And I wanted to just highlight some of the priority bills that we've been taking action on. And before I do that, shout out to all the subject matter experts. I see a lot of them on this call. They are our experts and the ones who provide reviews and feedbacks that shape our policy positions. I'm just a humble coordinator who gets to talk about it every once in a while. So shout out to all those experts. So going through a few of these bills, first one on the list is the Cottage Food Act. And this would have expanded the sale of cottage foods to ones that require refrigeration, and then would have likely increased the risk of foodborne illnesses. And this is a bill that BCPH opposed, and our environmental health team provided a lot of feedback on this bill to CALFO. And CALFO, when this bill was in committee, was actually the only representative on the opposed side to talk against this bill, and it was narrowly defeated in its first committee. So this was a good win for public health. Another bill on the list, the next one is the Healthy School Meals for All bill, and this would add 2 measures to the state ballot this year to better fund the program. And this is a bill that BCPH has supported from the start. Our Healthy Eating Active Living team has really been actively involved in advocacy and review of this bill, and BCPH registered an official support position for this bill as well, which is currently still under consideration. I'm going to skip down just a little bit to be a little conscious of time, but going down to the 5th bill, Intoxicating Substances Bill. This is another bill that we've been closely monitoring. It would require THC concentration labeling, and it would also raise the minimum age for 10% THC products, as well as flavored flavored marijuana products to 25. Our MBH staff and our Substance Use Advisory Group has reviewed this bill and provided feedback, and we're planning to coordinate with our local delegation on adjustments that we think would strengthen this bill. And then finally, you're going to just kind of cruise down to the end. We are still expecting the retail food fee bill, which I know we've talked about in the past. We're expecting that to be introduced in March. And this bill will, again, present a phased increase in fees over 3 years, 25% in year 1, 20% in year 2, and 20% in year 3. So again, these are just kind of a handful of bills that really have public health implications that we're closely monitoring. Next slide, please. So moving back to the state budget, Lexi and I want to provide some additional context on this issue and also just talk quickly about the impacts to public health. As you can see in this figure, without significant and ongoing actions to reduce obligations or to make additional revenues available, the state would exhaust the 15% general fund that it holds before the 2029 fiscal year, if it keeps going as is. And this is not including the potential for a recession. If a recession was to happen, this scenario would be expedited. So the major contributions to this, we've listed out here. First is the Taxpayer Bill of Rights, or TABOR. I'm sure you're all aware of this. It significantly limits the amount of revenue that the state can retain and spend. It's actually the strictest revenue limit nationwide, and for example, it led to about $1.7 billion in taxpayer refunds last year. There are escalating Medicaid expenses that account for about 1/3 of the general fund. And this is in part due to our aging population, I think the higher use of long-term care like nursing homes, and also due to rising costs of care. Recent tax reductions and ballot measures have also contributed. Last year, you may remember the state passed Senate Bill 24233, which was a significant reduction in property taxes, about 1.3 billion, that provided some short-term relief to property owners. And then finally, there's voter-approved measures like Prop 130, which passed last year, and that provides 350 million to support law enforcement training, retention, and hiring. So these measures have also really strained the state budget. So all that said, yeah, it's not pretty at the Capitol right now, and I'll hand it off to Lexi to talk about some potential impacts to public health.
Talk about something else.
So just to kind of focus in a little bit, the specific budget risks to public health to our agency at the state level. Can you go to the next slide? And you've seen some of this before, including the per capita. There's still a proposal on the table for a 5% reduction. Family Connects was originally proposed at 20%. Now it's being scaled back to a 10% reduction. The Amendment 35, which are tobacco tax revenues, are declining, which in many ways is great. But when you become dependent on sin taxes for your prevention work, then it creates a little bit of a challenge. But at the same time, Prop EE is increasing, and we're hoping that those are going to offset each other.
And remind me what Prop EE is. Sorry, I can't remember what that is.
I can't remember what it is offhand either.
Okay.
I'll get back to you in a second.
Yeah.
Yeah, and then
Did it have to do with gambling? Anyway.
I'll get back to you in a second.
That sounds sinful too, so probably same category. Okay, don't worry about it.
And then the Medicaid payments for community health workers that were supposed to take effect in July in Colorado, we're concerned that those may be rescinded. And then obviously the secondary impacts of all of the cuts to health and human services, you know, decreasing Medicaid, what does that do to child health that may hit our maternal and child health programs or things like that? Some of the supports that could influence mental and behavioral health that then fall on public health for our sister agencies and create, you know, extra workloads. So those are some of the concerns in that space.
EE was a tax on vaping and other nicotine
That's
products.
Thank you very much. Okay, next slide. Yeah, and so the federal and sorry, I'm just trying to catch up to my own slides. The federal budget and policy updates real quickly. We have been receiving more of our backlog revenues, so that's a good sign for January and February. The FEP, the Emergency Management Grant, which is federal grant, has been renewed, but we're not sure about the commitment because if the 26 budget, federal budget, that takes effect October 1st, theoretically could affect that. Immunization, we hear immunization funding is going to be under a new contract, which I think creates some additional risk of it being renewed. And then some of our MBH activities have required changes due to the interpretation of DEI work. Kind of more broadly at the federal level, not so much focused on our specific agency, the prevention fund is at risk, which is a shame because that has been an enormous support to public health since the Obama administration. We are looking at reduced grant funding and support staff to help us manage those grants from the federal side. We really depend on staff in the agencies that provide grants to help us manage them, work through them. We get guidance from them. The feds are talking about 15% indirect maximum, which would reduce our indirects by about 8%. And then again, those secondary impacts. And then this issue of the 26 budget, a continuing resolution wouldn't necessarily be in our interest. That could create some funding risks. And at the same time, what we're seeing coming down as the proposal is also not good. So that makes it a little bit of a tricky situation. Finally, just to kind of, I think this kind of sums it all up. When we talk to our federal legislators, they are asking public health to identify its most important funding priorities for their protection. Okay, and then finally, as you know, I've met with Senator Malaway, Representative Brown, and Representative Joseph's offices regarding public health funding. We had really good conversations with their staff or them. We're going to be adding all of our state delegation to our press releases. We had some of them, but not all of them. So we're going to be consistent about making sure that they all get our press releases. They had some very specific questions for us in some conversations, which were really helpful. And we were able to really emphasize the need for them to defend public health, and also provided some specific areas of bills that each of them were interested in terms of kind of what the public health perspective was on those. We are hoping to have more regular check-ins with them, which I think will be great, especially as we move after the legislative session to downtime, so that we can do more kind of long-term strategic planning in collaboration with them. We are also drafting some letters to our federal delegation about the need to protect public health funding and the impact it will have on the health of their communities, as well as some of the chilling effects that some of these executive orders are having to our most vulnerable populations, and the need to have those rescinded and to continue to challenge them. Right. So we should have more information for you next month.
I was gonna say, I don't know if you're talking about this in the subcommittee, but the revenue change, federal revenue change, I'm curious if, like, we just went through that recently, so I'm curious what that.
Well, Lexi and Armando had presented some to us, but no, there hasn't been specific scenario planning. To know more than what we knew about from the.
Right, because we had percentages.
Yeah,
January,
because-
February, it's like that's changed, I'm just kidding.
Yeah, we've picked up on some.
Yeah, but until some of this is finalized,
Yeah,
it's all
it's
just
still-
scenario planning, so.
A lot of it is still uncertain. It's like, okay. I mean, I feel a little optimistic about that, maybe.
Let's stick with that.
Okay. In a very,
As long as
hard to be observant.
Right.
Got it. This is great update. Really
It's a lot.
appreciate it, yeah.
Yapping.
All right, I think this is our last agenda item, and we're gonna make it really quick. Just a reminder to our illustrious
fun.
Board of Health. That's right, we do have a couple of board members who have completed their annual training.
Except it does reset every year.
I just did it though, in January.
Oh, did you? Oh, okay.
Yes.
All right, so they haven't updated their website yet.
Yeah, I did it in January.
I think it counts.
Thank you.
I had to pick up one from last year that didn't show.
So we just really want to encourage you all. There were 4 options for how you all would like to do this. We're not gonna pin you down, but we really encourage the Board of Health to think about how y'all want to tackle this, either as a group or as individuals. I will say that CDPHE has developed some new materials, and they have like a much more comprehensive approach to training. Do you want to speak to that for a second, Patrick?
I mean, I would definitely recommend one of the 90-minute virtual sessions that they have. Because they've kind of gone through and looked at the 2 statutes. There's the training statute and the emergency response statute. And they've kind of just brought all that together in 90 minutes. So it's a pretty easy check off. I think they recognize they needed.
That's the one you went through and thought it was fairly
Yeah,
straightforward.
it's fairly painless and straightforward. Yeah. And it's informative. I mean, it's kind of nice to see some of the interviews from the other agencies around. And
Right.
Yeah.
Hey, Morgan, I'm wondering if we can just rally the board to all, like, just go for the April 10th date if it works for, like, just get it done. So we're not getting on the naughty list. So if they're not
Yeah,
publicly
I mean,
shaming us, but they should be.
Yeah, I mean, we could all do that if it works. I also want to, appreciate people have different
Schedules. Sure.
Yeah, schedules. So I'd say, you know, if you can sign up for one of them and let's commit ourselves to doing it. And I myself will, I am totally guilty of not fulfilling my obligation to do this. So I know it can be hard to do, especially on top of it. I mean, for me, I have told Lexi this, that when I am spending multiple hours in Board of Health related meetings in one week, it is hard to then sign up for another one. So that's, you know, I need to bump it up on my own priority list, but I can commit to the April 10th. I just put it on my calendar. So if anyone wants to join me,
I'm committing to the April 10th as well, and maybe, I don't know, it sounds like Brooke's done.
I thought I did
Maybe.
it in January, but
Yeah.
I'll go back and check.
So I don't know, Landry is still on, and Amber, I think did Amber?
What did you say?
Amber's done hers too. Is that right, Patrick?
I'm post call on the 10th. I don't know. What time is it? What time would it be?
It's 11 to 12:30.
I do not know my schedule for April yet. My schedule changes every quarter. So I have to, cannot commit currently.
Well, you might not need to.
So there's
I have to
also
go back and
an
check.
option to take the training asynchronously. So you can just like elect to go on and take the training. It can be facilitated or not, and we are here to support you if you have questions, if you need help, if you need someone to cheer you on. We can provide awards, whatever is
It
helpful.
sounds like give us an award.
Here you go.
Buy lunch.
You need to buy lunch. But we want to be supportive,
Okay.
with whatever works for you all. Okay?
That sounds good. We'll
And I can
do our
coordinate.
jobs here.
thanks
plan
for
off.
keeping us honest, Patrick, and making sure that this stays in the forefront of our minds.
Yeah.
Okay. Director's report. I don't have anything particular to announce, except that you will continue to see kind of shifts in the director's report as we migrate to this kind of strategic priority focused approach. This is a big change for our staff, not just in terms of what do I put in the director's report, but all of the work that's required to come together and talk together about how they're working together to, you know, have the content for that. So thanks for your patience, and I hope it's starting to feel like the director's report is getting at what you're interested in. But please give me feedback. If there are ways that you continue to see the director's report needing to shift, because that's what we're we're in a flexible mode right now. We are trying to figure out what is the most useful for the board. So feedback very much welcome. Do we have any older new business?
Hot off the presses.
I wasn't gonna say.
She has to do her training for 25.
I was gonna call her out. But
Oh, yeah, I did.
we're gonna,
Yeah, I did. Did,
all right, we are gonna do better. No, Lexi, nothing. I don't think anything in the room. Morgan, Amber, Hendry. Okay.
All right, last agenda item. Are we ready to adjourn?
I think so. Thanks everyone. Thanks for the really good updates tonight too. Really helpful to know all the work that's going on behind the scenes and in between meetings. So thank you.
Thank you all.
Thanks.
Have a good
Have a
night.
good night.
Thanks, everyone.
Thanks, team.
So I'm just.
Oh, wow.
Yeah, I know.
You see in person.
What?
I know.
It's the one I said?
I know.
Yeah.
I don't know. I know, it's so hit or miss.
It's this one.